Key terms, chapter 12 and 13. Trace minerals are needed in the body in very small amounts, 100 milligrams or less per day. Major minerals are needed by the body in 100 milligrams or greater per day. Anions are a group of atoms with an electrical charge. A little bit of science review. Your anions are the negative charge and cations carry a positive charge. Aldosterone is that very important hormone that's made in the adrenal gland, which remember is on top of the kidney. That aldosterone affects your blood pressure because it helps the body to retain sodium. And so when we look at some of our blood pressure meds, we know that we have to maybe affect aldosterone hormone to help regulate the amount of sodium that the body retains. Plasma is that fluid portion of the blood that has our blood cells and other components. Oxalic acid is an organic acid in some of our leafy green vegetables like spinach. It binds to calcium, and that combination then forms calcium oxalate, an insoluble compound that the body cannot absorb. So when you have this binding, the body then eliminates the calcium. Salts are compounds that result when hydrogen of an acid is replaced with a metal or a group that acts like a metal. And when we look at insensible water loss, that is where we are unable to count it. It's a continual loss through evaporation, either from the respiratory system or tract. You've probably walked outside on a cold day and seen your breath, and that is the water loss when it hits the air. Electrolytes are substances that bind to form those charged ions that we were just talking about. Often electrolytes and ions are kind of used interchangeably, but when we talk about electrolytes in this class, a lot of times we talk about the lab values, like we need to get electrolyte lab values, looking at your sodium, potassium, magnesium, chloride. Those are the electrolytes that become very important in healthcare. Fibrin is kind of that insoluble protein that's the final product of the blood clotting process. So when we look at the ability of the body to make blood clots, we know that it takes protein for that to happen. Osmosis is moving water through that semi-permeable membrane from a dilute to a concentrated side until they're equal on both sides. We see osmosis when you boil a hot dog because if you boil it too long, that hot dog absorbs more and more water from the pan, and the skin will eventually rupture or break as a result of osmosis. Phytic acid then is a phosphorus-containing compound in the outer husk of our grain cereals, and that binds with minerals to inhibit their absorption. Osteoclasts are bone cells that break down the bone structure. Clast is to break down. Antidiuretic hormone is a hormone that's secreted by the pituitary gland that helps increase blood pressure. Anti is against. Diuresis is to void or to get rid of. So this is against that. So your antidiuretic hormone actually increases your blood pressure because it tells the kidneys to hang on to the extra fluid. Hypertension is that condition of having high blood pressure. Hyper is the prefix above. It's considered 140 over 90 is hypertension or high blood pressure. Fluorosis is mottling, discoloration, and pitting of the teeth, especially the enamel from prolonged ingestion of excessive fluoride. So fluoride is good for the enamel of the teeth. We drink a lot of fluoridated water. Water in the public water treatment is fluoridated to improve the enamel, but too much of that can cause fluorosis. Albumin is a protein that circulates in the blood, and it does many important things, but as a nurse I know that albumin is most often looked at for the edema. Somebody that has a lot of swelling or edema, they are probably lacking albumin. Again, it's a protein that's obtained from the diet, and it helps kind of keep fluid in the circulation, in the blood vessels, instead of leaking out or becoming lazy and going into the interstitial spaces causing edema. Transferrin is a protein that's made in the liver, and it transports iron to the red blood cells. The patient that we think of with this as a problem is your cirrhosis of the liver patient that has damage to the liver and they're not able to make this protein then that can be used. Hemosiderin is an insoluble form of storage iron, and ferritin is our major storage form of iron. So how iron is stored in the body is called ferritin, and you'll see checking patients for anemia, a lot of times they will check ferritin levels. When we think of a couple syndromes that are opposite of each other, Meniere's syndrome is copper deficiency, and Wilson's is increased copper absorption, which leads to toxicity. Both are fairly rare. Hypogonadism is a decreased activity of the gonads, either the ovaries or the testes, with retardation of growth and sexual development. Hypo, remember, is below. Hemairon, it's that iron that's found in hemoglobin and myoglobin in the animal foods. When we look at this a chemical complex with that central iron atom forming that oxygen binding part of hemoglobin and myoglobin, that's hema. And when we see the transporting protein, that's your myoglobin. Iron in plants is non-hema. And when we start looking at your vegetarian that doesn't eat animal products, we know then that they need that have a limited amount of iron in their diet because the iron in plants is somewhat limited. Toxicity from too much iron is called an iron overload, and then a condition that's hereditary called hemochromatosis is a disorder in which there's excessive amounts of iron absorbed. It's not as common in women because of the menstrual loss that they have every month. So again, it would be more common in men, and it can be abnormal iron in the liver and other tissues that cause damage. Creatism is a congenital condition with mental retardation resulting, and it's from an iodine deficiency during gestation. It's not very often seen, but it can be prevented with correct diet. A goiter, when we start looking then at the neck, at the thyroid gland, goiter is the enlargement of that thyroid gland with that visible swelling in the front of the neck, and it's not seen very often because we have iodized salt today, and so iodine deficiency is very, very rare. Hypothyroidism is your lowered level of circulating thyroid hormone, and we need to find the cause of hypothyroidism. Sometimes it can be replaced with a medication, and sometimes they have to go in and do surgery. But with hypothyroidism, it's like the metabolism is really slowed down. The person is cold and slow and not very energetic. They gain weight. And then things that interfere with iodine absorption that's in the diet that can induce goiter would be goitergens. And lastly, TSH, or thyroid stimulating hormone, is that hormone that's made in the pituitary in the brain then, and it regulates the making and the production of thyroid hormones. This ends our key terms for Unit 11.